talk on an important topic which many people keep asking me, and that is how to do the crown area and what are the challenges involved in doing crown area restoration, hair transplant. So we will deal with the questions one by one, the questions that have been asked to me in the last 1 month or so. So number one question is that what makes the crown area restoration different from other area restorations, like for the hairline, like for the mid-scalp, like for the temple points? Well, the crown area is replete with a lot of challenges, and the basic challenge is firstly that we do not have an infinite number of grafts. If we had an infinite number of grafts, if a person was so well endowed, then there is no problem. We can give as much density as a person wants. Also, if a person has baldness which is stabilized, he's around say 35 to 40 years old or 45, 50, and we are confident of the fact that the baldness is not going to progress any further, we can give as many grafts as he wants and cover the crown fully with full density and make it look naturally dense, conforming to the whorl patterns, without any skin show and without any danger of progression of baldness. In these cases, we become more confident and can do much more than we would be able to do in a person who's 25 years old. A person who's 25 years who has a strong family history of baldness, and there are visible signs of his hair loss going to progress. In such cases, we are restricted by the fact that we do not know which side the camel will turn, because at 25 it's too difficult to predict the future of baldness in that person. Because even if we have family history, it's not that whatever your father had the Norwood scale of baldness, you're going to have the same one. Baldness patterns ultimately are also determined by your environmental factors. What stressors your father had may be much lesser than what you have today. So these are the things that we have to take into consideration, because we are very unsure about the future. So we have to be a little cautious about how many grafts we harvest, which areas we cover or cover at all. So these are the factors which compound crown area restoration. If it is a simple grade 2, grade 3, even grade 4 male pattern baldness, there is no problem. We have enough grafts from the scalp itself to do justice. But when there is extensive baldness, matters come to a head, and we do not know really whether to recruit so many grafts in one go and cover the areas which are evolving and even future-proof the areas which are thinning. So these are the problems with crown hair transplant. And also the crown hair transplant is also a little bit more challenging because it's all about physics. When you see the hairline restored from the front, there are hair one behind the other, and there are also natural hair which act as a curtain and don't let light pass through. So when we see hair end on along the hairline one behind the other, we need not give so much of density, because it is being compensated by hair which are around it, and it gives the feeling, it gives the impression, the illusion of fullness. It's just like standing in front of the forest. When you stand in front of the forest, it looks very dense because you see trees one behind the other and light cannot pass through. But when you see the same forest from up above a hill, you climb up to a hill and see the same forest, it will not look as dense. So this is the same corollary we have for the crown area. In the hairline, we see like seeing a forest from the front, whereas the crown is seen from the top of the hill, and still light shines. Also, the convexity of the scalp, the convexity of your skull at the back of the head is such that it reflects light in a more adverse manner, so to say. It reflects light shines light in much more visible patterns than it would along the hairline. So this is the conundrum that we face while restoring the hairline and restoring the crown area, the difference between the two. And also, many times, patients feel that the crown needs more density. Now, this is also a big challenge because it is such that societal pressure is such that the crown is the one which is considered as the area that should be restored, not the hairline, at least in Indian society. So this comes up with a lot of technical problems for us as hair transplant surgeons, and a lot of counseling is required to explain to the patient how hair transplants are done and what about hair transplants, how much grafts we have, and how much grafts we can use in one particular hair restoration session. And this brings us to the second question. How does the whorl pattern of the crown affect hair transplant results? Yes, usually we have one whorl in most patients. About, I think, 80 to 85% patients have only one whorl. So when there is only one whorl situated high up in the crown area, it has to be replicated. Because if you do not replicate the crown whorl, it's going to look artificial. The crown is meant to form a swirl-like fashion, a whorl pattern. So we have to carefully orient the grafts, angulate the grafts, such that we are carefully copying what nature has made in the crown area. Because if we go against the flow of the hair, firstly, the rest of the hair which follows also the crown area, which is not yet bald, your planted hair will not synchronize properly with the existing hair. So there will be some amount of artificiality in restoring a crown area without following the whorl pattern. Now coming to the people who have two whorl patterns or even sometimes three whorl patterns, well, these are very difficult to even think of restoring, especially in cases who have extensive baldness, who are young, who have a family history of extensive baldness, because crown restoration following the whorl pattern takes away a lot of grafts. So do we have infinite number of grafts? Can we restore both the crowns with so many grafts? No, we cannot. So therefore, when we have two crowns, it has to be diligently considered. We have to be very judicious in our decision of which crown to cover, the crown that will utilize the least number of grafts. So that these are certain compromises we have to make in giving a better coverage to the crown area and overall fulfilling the overall objectives of the patient in the long term. The next question is, can a hair transplant fully cover a bald crown? Well, if density is not a concern, yes, it can fully, but what we want to achieve is consider a density that will give you an illusion of fullness, and it will conform to the patterns of the whorl, and it will also stand the test of time. Unlike the hairline, if the native hairline recedes further, the hairline is covering up. You can grow your hair long and cover that area till such time another hair transplant can be done. Whereas in the crown area dynamics is such that it expands circumferentially. So when it expands circumferentially, and if we have given a very high density in the center in the previous hair transplant, so needless to state that if we have given high density in the center, say 40 grafts per centimeter square, we will perforce have to give the same density in the new area which has occurred because of the circumferential expansion of the crown area. Because if we do not, there will be lighter density, a halo effect around the previously planted area, which we want to avoid because it will look unnatural. So therefore, it is the ball is in the doctor's court, the surgeon's court who's doing a hair transplant, to predict the level of baldness, to predict the lifetime number of grafts available in this patient, so that if baldness continues to progress, he can give the same amount of density that he had given originally in the crown area, which was that time bald, to the new areas which have occurred due to circumferential expansion of the new balding in the crown zone. Because if you do not, it will cause an island effect. And island effect looks very, very unnatural and is a huge giveaway that the patient has undergone a hair transplant procedure. So this is another difference between crown hair restoration and the hairline hair restoration. Now, how long does it take to see results in the crown area? Well, the same amount of time as it takes in the hairline. The only difference is you see hairline results faster because, as I said earlier, hairlines are done in higher density, whereas the crowns are done in lower density, keeping in mind the future progression of baldness, so that we have enough grafts for future use. So therefore, it seems to people that crown hair restoration does not give the same results as hairline restoration does, whereas it is not the truth. Can a hair transplant stop future baldness in the crown? No, not at all. The baldness gene isn't gone to sleep yet. The baldness will continue to do its job. The hair loss gene will continue to wipe away your graft's native thinning hair if the baldness hasn't stopped yet, if the baldness isn't stable. So with a hair transplant, we are merely covering the bald areas, and if baldness progresses, it will take away from the result, because those hair which are giving an illusion along with transplanted hair of fullness have gone away, and now only the transplanted area is left. So you will have to add more grafts provided they are available. So the best thing to do is to prevent future progression, take charge of your baldness, go on to hair loss treatment like DHT blockers and hair stimulants, so that progression is not rapid, especially if you're young and you have a strong family history of baldness. Will a crown transplant look natural over time? Yes, definitely it does. Crown transplant, if you see my results on my channel, on my YouTube channel, go on to crown hair restoration playlist, you'll see that the hair transplant results of crown are absolutely natural. They are undetectable if the procedure has been done properly. If the crown whorl pattern, the whorl pattern, the swirl pattern has been followed and its integrity has been respected, yes, we get very good results, natural results. How many grafts are needed to cover a bald crown? Well, whatever grafts are left after doing the hairline, and keeping in mind future progression of grafts. So I would say that if a person is grade 5, you would need about 2200 grafts. If a person is grade 6, we should not use more than 2500 grafts, because you will have future progression of baldness. The sides will descend down, the humps will go down, the crown will expand circumferentially, even the hairline, the native hairline will push back. So this is an individualized decision, how many grafts one needs for the crown area. You show me a person who's bald, I will assess him, assess his age, his family history, and I'll tell you how many grafts this person will need during this particular session of hair transplant. So that was the short live session for today. If you have any questions about hair transplant, hair loss treatment for men and women, do let me know. Send me a message on this video or on any of my other videos, and I'll try my best to include it in my next video session that will be tomorrow.